on, and then we can start. You can talk to everyone until it gets started.
So
they're not.
We're gonna go over actually the protocol.
We're gonna wait till more people jump on. So if you want to just chat and shoot the breeze, Dr. Jacobs, feel free. Just anything you want to talk about. It doesn't have to be about the tools yet. We gotta wait till people jump
What
on.
do I have for breakfast?
Go ahead. What'd you have for breakfast?
Well, I have my famous homemade cereal.
Go ahead. What's in your cereal?
It's I put like chia seed, flax seed, cinnamon, coconut, shredded coconut, nuts and seeds, ghee, butter.
How are you feeling with all that? Did you go to the bathroom already?
Awesome. Yeah, I have to dump it.
Oh my gosh. Oh, I apologize on his behalf because I'm sure that was very offensive for some people.
Yeah, so it keep you regular, keep you.
We're just waiting for people to jump on. We're doing a very spur of the moment live for you guys. So if you have any questions, let us know. But we're going to just, again, shoot the breeze until some more people jump on.
People are working now.
Everyone's at home, I'm sure.
Not during COVID.
Especially during COVID.
Hopefully they are working.
Yes, I do hope you guys are working and having a great day so far.
Yeah.
It's Friday. What are we doing this weekend?
Oh, take care of the kids.
This is our last day of freedom before the weekend.
Yeah.
So this is our office. My phone is attached here. I can't even begin to like show our office at this point. I don't think we'll do that today.
Yeah, we'll do it.
Going back to the weekend, I know it's a mess. What plans do we have for this weekend?
Oh, nothing. We'll try to get a trampoline for the kids. So I don't know if it's gonna come this weekend.
Mm-hmm.
Yeah, and that's gonna take a few hours of installing, but I'm looking forward to have them have something to play with.
Okay, let's get started because people are busy. So okay. So what are we doing today?
So we're gonna go over common shoulder protocols. We're gonna divide it based on the severity of the cases from mild, moderate to severe. So if you've been diagnosed with like tendonitis, bursitis, or frozen shoulder, a lot of these diagnoses does not really tell how severe the condition. So we need to know how severe the condition so in order to treat it properly. We'll give an example for tendonitis. If it's a mild case, like your pain level from like around 3 or 4, and it's happened sporadically throughout the day, like when you're reaching or lifting something, just once in a while pain, that's a sign of a mild condition, which is we say it's a mild proliferation or inflammation based on the healing cycle. I'm not going to go into that. So if you have a mild cases that happen once in a while, we have in the patient toolkit 4 tools that actually work on one tool like the A3, it's work on the scar tissue, so you can really work on your shoulder while you are at home. So this tool is A3 for the scar tissue. Also include the A1. We use the A1 to release superficial and deep fascia, and it's very easy to use at home. And the A5, we use that to break down deep scar tissue and release deep fascia restrictions. So it can be used like this. And the last tool that we included in the patient toolkit is the MagnaHeal 1. This is good for mild to moderate inflammation. If you have severe inflammation, we usually recommend the MagnaHeal 2 because it's 2 to 3 times stronger. So that can be used very easily on the shoulder, or it comes with the ACE bandage that you can wrap it if you have a little bit more inflammation. But mild inflammation is sporadic pain, gonna happen once in a while, pain level less than 4 out of 10 scale. So we're gonna move to another case of tendonitis or bursitis. Or if they say you have kind of like a partial tear rotator cuff or mild tear rotator cuff, that could be on a moderate pain. If you start to have pain throughout the day with weightlifting, you have a lingering pain, and the intensity of the pain increase up to like 6 out of 10 or 7 out of 10. Sharp pain when you lift anything, reaching. So the protocol gonna be a little bit different. We're gonna use the exact same tools, but with the moderate pain, we replace the MagnaHeal 1 with the MagnaHeal 2 because that's a stronger, and it comes with a strap that you can wrap it around.
Why don't you go get the adjustable straps and show them how the MagnaHeal? Do you have the straps with you?
Yeah, this is gonna be a little bit tight, but.
But can you show them? So that's meant to be worn.
Yeah.
So let's say they have, bursitis, tendonitis, frozen shoulder, mild, anything above a 4, you're going to be wearing this.
So yeah, it comes with the two extra straps that you can adjust it, test to adjustment. So to work on your shoulder, you can do it like across like this. And I like this.
Can you turn around so we can see the
Yeah.
swivel? There we go.
So
Cool.
the good thing about this, you can really have treatment throughout the day while you're working, walking, or even sleeping. So that's actually, this is my favorite tool, by the way, because it's very convenient and can be used throughout the day. We use that for moderate to severe inflammation. Why? Because when you have severe inflammation, you need to have higher exposure to the magnet to decrease the inflammation. So the way I do it is I try to find the inflammation area, or you can tell from like the spot of the pain. If you feel your pain right on the top here, I'll just get it on the top.
I like to take it out of the magnet. I like to take it, so you can actually show them. So there's an area to take the magnet out. I like to apply it directly to the skin.
So
It's stronger that way.
you can take it out from the back. So you can take it out here and put it back in.
What makes the MagnaHeal 2 special though? So why is that an important tool?
So because it's 2 to 3 times stronger than the MagnaHeal 1. It's bigger, so the stronger, the faster the result's gonna be.
What's the Gauss on that?
It's actually at least like 2,000 to 4,000 at least.
So how many of these have you tested? How many magnets have you tested before you came up with MagnaHeal 1 and MagnaHeal 2?
At least 50 to 100 tests with different coating, with different sizing, with different material and different thickness. So definitely with the bigger size, you're gonna get faster result. And when we measured the length of the field, it was around 3 inches away from the magnet. So technically, it should penetrate the body 3 inches in, which is a good news for a lot of shoulder patient because you really can get it deep to where you have the issue.
Have you used the MagnaHeal 2 on yourself?
Yes, I did. And we had
What did you use it for?
You remember, we had that case, actually, I dislocated a couple of days ago, my thumb. And
He was putting dishes in the dishwasher.
yes, and it's actually, I was pushing this way and I'm forcing it, and actually it flipped it back. So my thumb, and we have another video for it, I could not even bend it this way. And that was 2 days ago, and I used it just 2 hours, and I'm able to bend it now. Before it was really swelling, but I did not do much treatment, I just did a couple of hours. So, and just in the matter of day and a half treatment, so that's really...
For someone who has moderate inflammation though, how many days will they have to wear that magnet, either sleeping or just in general?
So it depends on the severity of the symptoms. So you can wear it like 4 to 8 hours or sleep with it. Take it off, see how you feel. If you start to get back to normal, you don't have to wear it again, but you're gonna wear that. And each day you're gonna use the other tools to break the scar tissue, because the MagnaHeal, it's gonna help with inflammation, but it's not gonna break your scar tissue, which we need the A3 for it. or it will not gonna release your fascial restriction. So we need the A1. So the typical protocol, you're gonna spend on average 5 minutes just to work on yourself with the tools. And then if you have severe, moderate to severe inflammation, just put the MagnaHeal on and just continue with your day, you know. So that's usually the protocol for it.
So for someone who has very severe inflammation, like frozen shoulder or a partial tear, rotator cuff tear, chronic issue, what are they going to do that's different than what you just talked about?
So for severe case, we include with the moderate case those 3 tools. So for severe condition, usually patient have some kind of vitamins and mineral deficiency, and especially like frozen shoulder, and that's where I have the inflammation supplement kit. It's a very common to have with frozen shoulder, like magnesium deficiency, K2, D3 deficiency. These are formula to help with inflammation, and this is a formula for inflammation. It has C, it has turmeric, it has bromelain, it has quercetin and retin. So
can you go over again? What are the 3 supplements?
So the 3 supplements, K2 and D3.
Okay, so this is our K2 and D3. Can you flip it towards me? There you go.
Okay.
That's the K2, D3.
So because it's a really common with frozen shoulder that patient might have D deficiency or K2 and magnesium. So, and the last one is the Inflaase. That's a formula for inflammation. This is very comprehensive inflammation supplement kit. If you don't have any other deficiency like hormonal imbalance or other deficiency, this should be good enough to start to help decrease your inflammation.
So really quickly, if you guys are jumping on right now and you have questions, so we're just going over his Dr. Jacob's shoulder protocol for mild, moderate, and severe cases. If you're running to work or have questions, would you please let us know in the comment section below so we can answer those for you? Any questions, it doesn't have to be about shoulder, it could be any body part. We want to be able to answer those questions for you. Okay, go ahead.
So you want to take the supplements early in the morning with meal, and I usually like to do the treatment afterward, and I do the tools, and then I would wear my MagnaHeal throughout the day, or you wear it at night. So, and the program for the patient shoulder program, you have to do exercises. So after the treatment, I have an exercise protocol you can follow to gain the range of motion. So that's basically the severe protocol.
How long will they have to follow this to see like the same outcomes that they see what you get on YouTube? How many treatment sessions will a severe, frozen shoulder case?
So if they don't have any other vitamins and mineral deficiencies, I had a patient just to start on this 1 to 2 treatments. Well, you start to notice a difference. So it depends on the severity of the inflammation and the deficiency. If it's severe inflammation, it might take a week or so.
So a week to 2 weeks is pretty average for frozen shoulder.
Yeah, but when I work with with patient, it's usually we run a lab work to figure out if they have other deficiency, because it's very common also to have some hormonal imbalance, and that's why we're launching Ask ASTR free online medical evaluation just to figure out if there's other deficiency involved.
So let's see, we do have a question. So thank you, Chaudhry, for asking that question. Let me just pull it up really quickly. Can you actually repost that again? I'm trying to see your comment, and I'm not able to see it since we're doing this live.
Refresh the screen.
And then, okay, just 1 second. Let me see. Yeah, I can't see the comments here. Chaudhry, can you repost that, please, so I can answer your question? For some reason, I can't see it. Okay, so while we're waiting on that question, so what if they don't get better? So let's say they do 2 weeks of treatment, they're consistent, and what exactly is going to come? So when they're doing the home treatment for shoulder, what exactly is included in that program?
For the severe pain package, it usually comes with the MagnaHeal 2. A5 to break deep and superficial fascia restrictions and scar tissue. A1 to release superficial and deep fascia. A3 to release the scar tissue. And it comes with standard supplements for inflammation. If they don't have severe deficiency in D or magnesium, they usually start to feel better in a few days.
Okay, so Chaudhry was asking, Dr. Jacobs, how can I relieve myself from pinch type pain invoked with high pitched noise in the region of head to shoulder?
So you feel like cracking or something like that. Usually when you start to have pain with sounds in the joint, that's a sign of severe restrictions. Let's say, for example, this is your spine, and you have muscle on the front and the back. So if you have tightness in your muscles, instead of the space between your vertebrae are open like this, so you can move freely, flex and extend, you start to have tightness and that space decrease, and you start to have restriction and you start to hear sounds. And that's a sign of you probably have a scar tissue or fascial restrictions, because our muscle should act like a rubber band. When it contracts and relaxes, it should stretch like this. But when you have a scar tissue or fascial restrictions, it's like you have an ordinary rubber band, so your muscle does not stretch much. So the way to relieve it, I will release it with breaking the scar tissue. If in your neck, you actually can do a lot of work on your own like this. And you have to release the fascia, the deep fascia with the tool. And if it's especially in the neck, you will have a lot of scar tissue in the trap area. And if you palpate.
Thank you, Mark.
In this area, you will notice there's big knots. You can do it on your own, and or you have a spouse to do it.
Another question, Chaudhry, is do you grind or clench your teeth? Do you have any jaw pain? Let us know if you have jaw pain, because that can be something that can contribute.
Well, if you have jaw pain, you might have headaches, you might have neck pain. There's a lot of muscle connected from the neck to the jaw to the head. So the best thing is to figure out what is the trigger. How did you injure yourself? Or if there's no mechanism of injury, it's probably going to be like poor posture or body mechanic that lead to that, or poor habit, like slouching in the front of the computer, because those position is actually, if you maintain this position for a very long time, you start to have inflammation in the neck or scar tissue that cause tightness in the muscle and decrease the range of motion, that limited the movement, and when you move, you start to have sound. You start to hear sounds.
Okay. Does anyone else have questions at all regarding your case? We're here really to talk a little bit about shoulder pain and how Dr. Jacobs' recommendations for that. If you have any questions, please put it in the comment section so we can answer while we're here live, okay? Okay, so let's talk about, you mentioned what comes in our basic, like moderate and severe package. Let's talk about the program when they take the step-by-step program for shoulder.
So the program is very simple. What I try to do is really, you can watch the video and just follow. So we have a video with the model just to show how she can do it on herself.
We have a question. Do you suggest shoulder steroid injections? Hi, Dr. Mohammed.
Hello. So let's go to the science, okay? So steroid is for inflammation, but if you have a problem with the shoulder, inflammation is not the only issue. Steroid is not going to break the scar tissue. It's not going to release the fascial restrictions. And you want to look online for the side effect of a steroid, because if they overdid it with the steroid, there's very high chance it's gonna cause degeneration in the joint. So it depends on the practitioner how much they put in. Too much of a steroid, it causes degeneration, and if that's gonna happen internally in the joint, that degeneration usually cannot be reversed.
And we have a lot of patients that do come. They've had steroid injections. It's very common. What's going to be our typical protocol? There's two scenarios. Let's say the best case scenario for someone that has a lot of inflammation. We just went over it. What are the three things that we're going to have them do?
So best case scenario, if they don't have hormonal imbalance with the pain, Just the supplements with the tools should be enough.
Can we go specifically over your inflammation protocol? There's
Okay,
3 things that
so
we would
the
have you
inflammation
do.
Protocol, we have to do 3 things. One is the anti-inflammatory diet, because there's a lot of food that actually increase the inflammation. So I go over this diet in detail in the protocol, in the program. The second thing is the supplements to help with decreasing the inflammation. The third,
And doctor, just to go over what those supplements are,
okay.
it's the K2D3, our
K2, D3, magnesium, Inflais. This is a formula including C, turmeric, bromelain, retin.
So those are the 3 supplements we would, for a standard of care, if you had inflammation, that's what we would put you on.
Yeah.
Okay? These are Dr. Jacobs formulas. Do you want to talk a little bit about those formulas?
So I decided on these formulas based on the common deficiency with musculoskeletal issues. So you need D, you need magnesium, you need other supplements for your body to transition from inflammation stage to proliferation to maturation, and that's why I try to address with these formulas.
Okay, so but as far as like how you develop the formulas, and so that they, the common person can understand what makes your formula special. Why do our patients respond so well when we're like, instead of getting, let's say they've had the steroid injection, they've gone and they've taken some anti-inflammatory drugs. Our protocol, which you talked about, which is the supplements, the diet. Why are these supplements a better option
So
for the patients?
I will give you an example. Like there's several times, for example, like calcium. There's like 7, 8 at least type of calcium. So there is a couple of them that absorbable and other one not absorbable. So what's special is I choose the bioavailability ingredients that's actually absorbable, because you can get like calcium cheap, like 500 capsule for $2 or something like that. So it has to be high potency that the body absorb it. And the other thing is there's ingredients that you cannot put it together because it's going to interfere with healing. And the other issue with a lot of supplements is, especially when you start to have minerals, you don't know really how much mineral, because magnesium or calcium, it has to bind to other minerals to make it in the formula and for your body to absorb it. You don't know how much the elemental magnesium. For example, some formula they have 50% is actually elemental magnesium.
Oh, wait, I don't want, what is the word you're saying?
Elemental.
Elemental?
Yes, which means the pure magnesium. Or some other formula have 5%. So the one that have 5%, you need to take 10 capsules, but the manufacturer does not disclose that information, which make it harder for a patient to dosage themselves and to know really how much I need to take.
So when they take our shoulder program or any other program, they will have access to the dosing.
The dosing will be included, the diet, the time of the day, everything is included, so they can really comfortably can implement it at home.
So our inflammation protocol is the anti-inflammatory diet, these supplements that you see right here, and then the third thing is going to be the MagnaHeal 2, which we talked about. If you want to go back, we can talk more about that, but that's going to be the third part of our protocol. Now, worst case scenario, let's say they do all this for 2 weeks and they're only 50% better. What would be the next step for that patient?
So the next step either, we launched the Ask ASTR free online evaluation. You can use that to really figure out if you have any other hormonal or vitamin deficiency, because it's if there's deficiency, we need to get to the root cause of the problem, which what is missing in the healing for your body to heal. Or we can schedule telehealth.
So right now, Ask ASTR is not ready. It will be ready in the next couple of months. So if you are currently in pain, or if you, whatever, it doesn't just have to be shoulder. We want you to, if you start our program and you're not 90% better by that 2nd week mark, we want to set up a telehealth evaluation with you so Dr. Jacobs can go over your labs. He can do nutritional analysis with you, because we're going to be looking for things like, vitamin deficiencies, hormone imbalances, nutritional deficits, right? So those are the things we're going to be checking out.
We'll do nutrition evaluation and looking at the lab if you have lab. If you don't have lab, you don't have to worry about it. We request lab as needed based on the evaluation.
Okay, so we have a few more questions. Okay, so the next question was, I have a lot of inflammation. I bought the full toolkit. What's the best lubricant for the ASTR tools, or can I use them dry? Currently, why don't you answer that part and then we'll go to the next part of her question.
Okay, let's ask again.
I have a lot of hi Zach, we know you Zach. I have a lot of inflammation. I bought the full toolkit. What's the best? So go over what to use with, and that's actually in the program. But
So, yeah, so if you have inflammation, I want you to really use all the tools. If you can tolerate the tools, go ahead. Don't cause inflammation. Just do it pain-free. If you feel the tool is too much and you are very tender from using the scar tissue and the fascia release tools, go ahead and start with the Magna Heal. Wear it as much as you can. Start with the anti-inflammatory diet, and next day, retest the tools. If you start to feel you can tolerate the other tools, go ahead. If not, every day you want to retest those tools to see if you're ready to do the release. But I will go full, start the inflammation protocol as soon as possible.
what is he going to use though for the tools? He asked, do I use a lubricant for the ASTR tools or do I use them dry? So can you go over each of the tools?
So each of the tools,
one at a time.
okay, so for the A1, no lotion. No lotion.
That's the
The
A5.
A5. For the A3, this is the only tool that you're gonna use either coconut oil or non-chemical massage lotion. And I usually use the A3 at the end, so I don't have to clean it twice. But for these tools, you have to use it dry.
Zach, did you get I can't see your what you purchased, but did you get any of the programs? He has neck, right shoulder, upper, and lower back pain.
Yeah, I usually include there's information about what you use and what to.
So if you didn't get a program, let us know. Sometimes patients just get like the kit or the tools by itself. But if you did purchase a program, we just updated those protocols actually last week. So Dr. Jacobs did an update. We do that periodically with, if there's new questions people have. Those programs are about an hour and a half long though, so.
Yeah, I didn't answer those questions.
Okay, Chaudhry has another question. So, thank you, Mark. We appreciate that. He says, Chaudhry says, I do have aura pain in the jaw, 2 broken teeth from clenching. There we go.
Okay.
So see how important it is to get to the source of the problem. So that's why we were asking, and the patient was saying that they have this, crazy, well, no, when they hear the sound, well, but let's see what the original question was, just so you guys know. So the original question was, I have pinch type of pain. When I hear high noises in the head or the shoulder, that's where they're getting these symptoms. But then we asked, well, do you grind or clench your teeth? So now we know this person has broken 2 teeth. And I did that about 11 years ago. I broke one of my molars from grinding and clenching my teeth. I had headaches and neck and shoulder pain. So now we know she has jaw pain from grinding and clenching her teeth. Why is this relevant?
Because if you really break your teeth, there's a sign, that's an indication you probably clench or grind 5 hours at least at night, 4 to 5 hours at night. Which means, do you go to the gym and do biceps curl for 5 hours? No one does that. But if you're clenching at night for that long period of time, you're gonna start to have a lot of inflammation, a lot of tightness, and it's not gonna be in the jaw only, it's gonna be in the shoulder and the neck area, and you're gonna build a lot of scar tissue throughout those areas. So the recommendation, actually, I will start to work on the jaw, doing the jaw program with the behavior modification.
Chaudhry, how bad is your pain 0 to 10? 10 is the worst. 10 is the worst. So how bad is your pain? Okay, go ahead.
So the goal is actually to decrease or limit or avoid the clenching.
So let's talk about that, because if we don't get to the source of the problem, as someone who has a history of TMJ, like I said, I was kind of the beginning of how you developed ASTR, right? My
Yes.
TMJ, I was a high school Spanish teacher, was under a lot of stress. I used to grind and clench my teeth. I broke one of my molars. And then that's kind of what made you start to look for solutions. Cause I did wear a night guard, but my issue was stress, which is what TMJ patients, any jaw patient, they're usually stressed out. So what are some of the things that they can do how does our TMJ program, our jaw program address the stress, address the behaviors?
So there's a lot of bad habit that you need to be avoided, like certain foods or certain things you eat, or like some people naturally they just clench throughout the day or at night. So there's a lot of behavior modification need to be done to prevent or eliminate the clenching part. So when you start doing the release on yourself, you're not messing it up at night. So there's a diet change, not
Even the way they sleep.
and
Like,
they
you
sleep.
can't just sleep however you want. You have to
If
sleep
you
in a,
sleep on your stomach, you know you have to sleep on your back or your side. You know there's certain things that does not matter how much work you're gonna do manually. If you're not gonna change or eliminate that trigger, you constantly re-injuring yourself.
I think one of the best things that helped me, and I'm sorry I'm not in the video today, I'm the one recording, but was actually relearning proper posture. Like, I'm gonna correct my posture right now.
Posture, settings.
So my posture, so like even the posture of my tongue, the posture of like the positioning of my jaw. Those are some of the, in our program for jaw, you're going to go over how to make those changes. So like once I started, sleeping a certain way, like if I would sleep on my side, it's just, even if I slept correctly on my side, for a TMJ patient, you can't do that. Because you'll notice that the side that you sleep on where you have the TMJ, you'll wake up with knots in the side of your jaw because that's the area where you tend to grind and tend to clench. So things like that, I started to pay attention to. And then, like he goes over positioning of the jaw, relaxation. This is like all the stuff that really makes a big difference for TMJ patients.
Exercises, because
If you guys have questions, let us know, please. We're going to be here for a little bit longer.
so the goal is to eliminate the trigger. So when you feel better after you doing the treatment on yourself, that feeling should hopefully last. And it's usually very common with TMJ or jaw. We shifted to the jaw based on the questions.
Yeah.
That people get headaches from that. And that's of course we need to work on the head area where you have the tightness, because a lot of those muscles are connected, especially the temporalis here.
Chaudhry said that the source of their pain was that a wave hit me. So like in the ocean?
Oh yeah, that's.
Oh my
that's
gosh.
probably
Are you a surfer? We used to live in California. We used to watch people like you.
Yeah, and give them our business card.
Oh my
It's a very good
goodness.
sport.
Neither of us surf. We were afraid of sharks.
Yeah, we just watch
The Nature Channel?
yeah.
Go ahead.
So yeah, so trauma, you probably wanna the location of the trauma or the way you have the trauma, that's a sign that of the location of the scar tissue on the fascia release. For example, I don't know where did you get the trauma or the head. If you fail this way and you hit your head this way and you jammed your jaw this way, you probably displaced your jaw upward this way. And you're gonna have a lot of scar tissue, a lot of tightness here. So that's one of the areas that need to be worked on, the whole area here. It depends on the head, it's hard to tell. You need to recall that, but if you cannot recall the whole event, I probably will release the jaw area, the head area, and the whole neck, and I will have someone really work on the back of the neck.
One thing I do want to talk about, because this is a question we've been getting lately, is how hard to use the tool. So we have a pain-free philosophy, Dr. Jacobs, and just our clinic in general. We don't inflict pain upon patients because that's like a big no-no. It causes more pain. But what we're noticing is that sometimes patients don't use enough pressure when they're using the home treatment tools. So can you talk about like that's like a fine line. We want you to get a good release. We want you to see outcomes with our tools. We don't want you to inflict pain. I think you need to show them or demonstrate or do something to explain to patients how they are to use the tools enough to get the release they need.
So to answer the first question, how easy is the tool can be used? My 5-year-old is actually can use the tool. So to use the tool, you really need to be like apply firm pressure. There is a fine line between pressure and pain. If you feel pressure from the tool, that's normal. We need to feel the pressure to do the release. But if you feel ouch, that's hurt, that's a sign there's a localized inflammation. So instead of me using the A3 here because it's really painful, I cannot tolerate it, I will use the MagnaHeal 1 or the MagnaHeal 2 until the inflammation goes down, and then I will go use the other tools as long as I can tolerate it. So the pain is a sign of inflammation.
So so there's a difference between like strong pressure and pain. Would you say that's correct? Like, how do they determine that threshold? Because we don't want them to hurt themselves,
Okay.
but we want to get a good outcome. So if you're doing a super light release with like the A3, they're probably not going to, or if they're not, even the A5, like if you take the A5, if they're not going deep enough, we had a patient yesterday that came, that had used our home treatment and then came in for a treatment. And they were just saying how it was noticeably more pressure, what Dr. Jacobs was applying, even though in the home treatment, we explain exactly how to do it. We want to make sure that if you guys are using our home treatment, toolkit with the programs, that you understand exactly how much pressure you can use. If your, scar tissue bands are super deep inside, show them with that A5. Let's just do an example.
So I basically palpate to figure out where is the tightness.
Okay, go there.
I don't feel any tenderness here.
No?
So I'm gonna give you an example of no inflammation.
Okay.
I don't feel any tenderness.
Turn your head so I can see it though.
So I have no issue with the tenderness, which means no inflammation. So what I'm gonna do is actually I'm gonna go as deep as I can.
Can you turn towards me? There,
this-
yeah. But remove your hand. They can't see the tool.
Okay.
Okay.
So I'm gonna go deep as much as I can, pain-free.
Go ahead.
Because I feel a little bit knot.
Okay.
I'm just giving an example. I feel knot here, so I'm actually going as deep as I can toward that knot to release it. We have to apply mechanical force that really on the knot itself.
Let me
or
see the tool,
bands.
please. I mean, for myself, because I actually, like I said, I have TMJ. I'm gonna do it on myself too. Go ahead.
Okay. So the difference is.
I'm really pushing in, like, so I have TMJ.
Yeah.
I don't want to go on the camera because I look a hot mess right now. I'm not going to do that to you guys.
So the other thing is you start.
I really do. I didn't do my hair today. I'm like really pushing in, probably like 2 inches into the tissue.
You really
It doesn't hurt, but I can feel it.
Pressure.
I can feel the pressure.
You feel pressure.
Yeah.
That's what we want.
You guys, it
We
feels so
want-
good when you have TMJ, when you grind your teeth and you wake up and you have that headache, that lingering
You definitely
headache.
can release it like on the spot in the morning.
I'm doing it right now.
So if you
Don't be jelly.
we want to feel pressure, but we don't want to feel pain. I will give you the second scenario, which like I am applying very light pressure and it's very sensitive and it's very painful.
Can you do it on your thumb where you had the trauma.
Well, no, I have pressure now after using the Magna here.
Your thumb still looks a little bit inflamed though.
It's swelling.
Let's
but,
see. Yeah, it's swollen.
Yesterday I could not. This is the range of motion I had yesterday. I displaced it, dislocated it. It went backward this
Wow.
way, and I had to push it back.
So you can't
don't
use
do that at home, okay?
So you can't use the.
So what I did, because it was really swelling, and we have another video for it. This is the range of motion I had, and I just used the MagnaHeal 2. This is the only thing because the inflammation. I use it basically 2 hours in a day and a half, and now I'm bending this way. There is still some work to do, but in a matter of a day and a half, that's a very good progress for me. And I could not use my thumb at all, like really holding anything.
So Chaudhry says no pain, just sorry. I don't understand that part. No live pain, just compensation and high pain upon normal range of motions at the rate of 6 to 7 out of 10. Goes away, leaves me alarmed or overwhelmed. Hold on. And then Chaudhry also said, not a surfer, independent information technology consultant. Wow. Karachi, New York City beaches. Okay, that's where this person surfed. Oh, not a surfer, they said. So must have done something while they were on the computer.
So
Any recommendations? So what would you recommend to Chaudhry? And I'm almost positive we've chatted before, Chaudhry, but go ahead.
So you really need to work on your posture, and you need to release
TMJ.
Well, we need to work on the TMJ. That's for sure. You want to release this area. because each person has a different bad body mechanics. Some people actually, after the trauma, they start to clinch or grind. And before the trauma, they did not have that issue. So we want to work on the sleeping posture, the sitting posture, the way you eat actually, the way of the location of your tongue. So we really need to make sure you're not doing something that actually make it worse, while at the same time doing the release. If it's not tender while you're using the tool, I will use all the tools. And if you feel there's an area that's very tender to touch and cannot tolerate any of those tools, I will go ahead and either MagnaHeal 1 or just wear the MagnaHeal 2. But based
If they're
on,
having 6 out of 7 pain, though, they definitely need to get the moderate. So
moderate.
Chaudhry, it's called the moderate inflammation. We have 3 different packages for patients. Mild, well, you can technically get the tools by itself, which no one does, and we don't recommend that. But there's mild, moderate, or severe. You fall in the moderate package because of your pain level. So it's all determined upon how much pain you feel. So you need to at least get the moderate pain package. The links are below for our website. And that's going to come with the patient toolkit, the upgrade to the MagnaHeal 2, which Dr. Jacobs is showing you right now.
You're probably going to wear that.
And then at least get the TMJ program. So it comes with 1 program for jaw, or 1 program you get to choose. We're recommending the jaw for you. Let me know if you have other questions. And if anybody else has questions, please let us know.
Yeah, and probably for your neck, you're gonna wear the MagnaHeal, especially if you sit in the front of the computer for a long time and you start to slouch forward. You probably want to work on this posture, and you can wear it throughout the day if that's if you have issue with your neck, and you can wrap it in your head. And
All of our tools are applicable for the full body. Today we were just going over our protocols for shoulder. Anyone that has like a kind of a lingering, annoying, 2 out of 10 issue, that's, 2 out of 10 pain, they would need the mild pain package. If you have more of a lingering case, or even something that just started where your pain levels are 5, 6, 7 out of 10, we'd want you on the moderate pain package. And then for severe cases, if you have, frozen shoulder, a minor tear, even a moderate tear in the rotator cuff, anything from 7 to 10 out of 10, we want you on that severe pain package, which includes everything you need for the inflammation protocol.
yeah, and if you have any other question, different body part, you can ask. That's fine.
If you have any other questions, we're getting ready to wrap up this live. We're going to try to do this on Fridays. If you have any other questions, or if you think of something else, we'll be back. But if there's anything else you guys need, you can leave it in the comment section below, and we'll get back to you as soon as we can. You guys have a great day, okay? Bye.
Bye.